Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is COVID-19, supporting ethical care and responding to workforce concerns in a public health emergency. And it is presented by Nancy Berlinger. Now, let me tell you about today's presenter, Nancy Berlinger. Nancy Berlinger is an expert in healthcare ethics at the Hastings Center, an independent bioethics research institute. She is the lead author of the Hastings Center's Ethical Framework for Healthcare Institutions Responding to Novel Coronavirus, SARS-CoV-2, COVID-19, and of related COVID-19 guidance, hospital ethics committees, and clinical ethics consultation.
So our learning objectives for this webinar are as follows. We're going to clarify public health duties in relation to the duty of care during a public health emergency. And this is important for hospital-based workers to understand because public health duties may be a less familiar area of ethics. We're going to identify ethical challenges in resource allocation, sometimes called staff, stuff, and space, and managing changing work conditions during a public health emergency. We're going to talk about the important issue of workforce stress concerns related to COVID-19 and the prolonged nature of this public health emergency. And we're going to talk about collaborating effectively with other hospitals and healthcare institutions regionally, something that's going to be very, very important in COVID-19 recovery as well as during initial crisis response. So these are the three topics that we're going to be talking about today. Duties to patients and publics, supporting the healthcare workforce, and safeguarding vulnerable populations. And first, we'll talk about the idea of what is a duty and who do we have duties to in healthcare. A duty is a moral or legal obligation associated with a role. It's something that we should do and indeed must do, or at least must try to do. COVID-19 healthcare response acknowledges this tension between the patient-focused duty of care, which we'll talk about more, familiar to clinicians, and duties to various publics during a public health emergency. So there's the idea of the general public, but there are also different groups of publics, like vulnerable populations, older adults, people with underlying healthcare conditions, first responders, and so on. So examples of public health duties of healthcare leaders during an infectious disease outbreak would include these three. There's the duty to plan, which you always hear about in public health ethics, no matter what the context is, for the management of foreseeable ethical challenges. By an ethical challenge, I mean a challenge about right or wrong action. What's the right thing to do during a public health emergency, including the fair allocation of limited or scarce resources, the staff, the stuff, and the space that I mentioned earlier. You don't want to wait for a crisis until you figure out how you're going to do these things. There's the duty to safeguard your workforce and vulnerable populations in the community. It's that basic idea of safety and protection. And there's the duty to guide healthcare workers experiencing demanding working conditions, ethical uncertainty, and moral distress during a public health emergency. So that's why you see a lot of attention on guidelines during this period. Now, in a public health emergency, whether it's a short-term emergency such as a tornado or a hurricane, or during this very prolonged, very complex public health emergency, where a lot of people are affected by COVID-19 because they've become very ill from it, and also where there's a widespread obligations to the public to shelter in place, to practice social distancing, because it's a contagious disease. We see all of these other duties that make focusing on the individual patient very challenging. As I mentioned earlier, there's a duty to plan ahead, there's a duty to safeguard, and there's a duty to guide. So what these duties recognize, they're not just more things you have to do. It's because we have to think about more than one person at once, more than one patient and more than one member of the community. So what public health duties are grounded in is the idea of justice and fairness. We have to recognize that people are equal. We have to promote equity, fairness in how we distribute risks and benefits. We can't just say, well, the patient in front of me gets all of the resources, or I like dealing with this patient, so they get more of something, or that patient is harder to care for, or I won't think about the people who are going to be diagnosed next week. We have to be fair in our resource allocation systems. And there's this larger focus on the community. So we really see during a public health emergency that hospitals are not just what goes on inside the hospital, but they're also what is going on outside of the hospital. I live in New York City, which is the epicenter of COVID-19 in the United States. So I'm very conscious of the sirens that I hear outside, which is the fire department, the ambulance responding probably to COVID-19 cases. I'm aware of why I and my family are staying at home, because we are protecting each other as community members, and we are seeing the benefits of having done this because our hospitalization rate in New York City is dropping, even though our hospitals are still filled with severely ill patients. So there is a participatory aspect of public health. Sometimes words like solidarity are used, the idea that we're in it together, or reciprocity, the idea of mutually protecting each other by wearing masks, for example. So there are all these levels of the public that actually involve people who are non-clinicians, who are participating in public health activities. So looking at this chart, which comes from the Kaiser Family Foundation, which is a great source of information on COVID-19, communities of color and low-income urban communities who often intersect are disproportionately at risk of chronic health conditions before COVID-19 and of having barriers to healthcare. So some of these would be conditions like chronic lung disease, chronic renal disease, because kidney failure is also associated with COVID-19. And so data that is coming out of the epidemic in the United States suggests that COVID-19 is disproportionately affecting communities that already had a high burden of chronic illness. So how do we begin to move from response, where we are right now in a crisis, to recovery, to thinking about how we get to the other side of this terrible crisis in our society? Regional collaboration is going to be very important. We're already seeing this on the East and West Coast when we see governors beginning to talk to each other and saying, well, when we talk about reopening schools or reopening businesses very gradually, we have to do this in conversation with each other. We don't want to have a unilateral response where one state does something different from the place that's right next to it. And that could be very bad for public health, because one thing we're going to be watching for in months ahead are outbreaks of this disease. There's going to be a lot more testing, a lot more surveillance, but there's going to be attention to hotspots, places where if we start to roll back social distancing, if the disease breaks out, we may have to go back to social distancing. So we're going to be thinking about life beyond our own neighborhood, our own state, but we're going to think about really how we're all connected to each other as an American public. So we'll be thinking about how do our duties to our patients and our publics play out across state lines and across large regions. What are the broad needs of a region's healthcare workforce? Who are the vulnerable populations across a region, and how should those populations be supported and protected? And what new challenges are going to start arising in the recovery phase of COVID-19? Some of those are going to be big justice concerns about where we invest public dollars toward recovery. Some of them are going to be about dealing with these underlying disparities that have put some populations at greater risk. Some are going to involve populations that will continue to be vulnerable to COVID-19 because until we have a vaccine or until we have other ways for there to be immunity, the people who are at risk of severe illness now will continue to be at risk. So we have to think about, should they be on their own dealing with this, or should we be putting different systems into place to better support people who may have to distance more than other members of society? And some of the suggestions that have come up would be making sure that high-speed internet is a utility, is much more broadly available, because regions do vary in how much internet access they've had. So if that's how your social life is working and your educational life, it's important that, as a matter of equity, that we all have access to it.
We encourage everyone watching this webinar to monitor the CITI program website for additional information about future webinars, available on-demand recordings of past webinars, and our new all-access webinar package.